Well, I'm here with Adrienne Nolan-Smith, who is, I think, one of the foremost experts in a skill that everybody should have if they want to really enhance their own health and well-being, especially in dealing with a healthcare system that actually may not do this, and that's patient advocacy. Adrienne, first of all, thank you for taking the time and allowing me to talk about this really important subject, and thank you for being here today.
Well, thank you very much for having me. I'm excited to share what I've learned.
So tell me a little bit about how you and why you became so interested and engaged in patient advocacy in your own life. What happened? What got you there?
Well, it's about 20 years, so I will shorten that a little bit. But I had several different experiences within the conventional healthcare system, two of which I was a patient, and then the last one, the most impactful, was as a caregiver for my mom when she was sick before she passed away. And so when I saw that there was going to be a board certification in patient advocacy offered, it was just after I'd left the conventional healthcare system as far as working in it. So I worked for 3 years with hospitals on patient engagement technology and had acquired a lot of, at the time I wasn't sure how I was going to use it, knowledge on all things within the healthcare system and some of the intricacies and details. And so when I saw this certification, I thought, I should sort of brain dump everything I've learned on this, because I had just founded my site and platform, Wellbe, which is more focused on helping people to see that the 100 choices they make are their healthcare, and then helping them get holistic and integrative practitioners and doctors when they do have a healthcare issue, so they can really get to the root cause of it and heal it naturally. But it was actually well positioned to do them together after I passed the board exam, because what I found was the more I talked about this need to have people look at the root causes and get to practitioners and doctors like yourself, the more people said, well, I have this healthcare situation and my doctor said this, and I don't even know a gut health specialist, and I'm outside of Cleveland, Ohio, and I've never even heard of an integrative OBGYN, and yet I can't get pregnant, and I'm having, can you kind of advise me, guide me, navigate me? Yeah. And so that's how it really worked well together. But the origin of that was originally having chronic Lyme disease. And this was an interesting experience because I really saw my mom advocating for me, which is why I'll explain what happened with my mom later. I felt it was very important that I then be there for her as her caregiver.
So you didn't get better just getting the standard conventional treatment for Lyme disease,
no,
right? I mean, the doctor said that's all we got, right? And you had to say, wait a minute, I'm still sick.
Exactly, yes.
Yeah.
I still had symptoms. My brother was being treated at the same time. He still had symptoms. And my mom, luckily, had enough wherewithal to look into the research and see that endless antibiotics were not really effective in getting people over chronic Lyme. And so she decided, we're going to try everything else. And this was largely before the internet. So the amount of good science or evidence-based papers on a lot of these different therapies wasn't there yet. But that didn't deter her at all. As long as it wasn't going to be harmful, we were going to try it. And so, we tried a lot of different things. But 2 years of many different natural therapies combined, my Lyme was in remission. Took my brother a little bit longer, but he too is fine. So that was a big experience, watching her advocate for us and really become this ferocious researcher and not taking this kind of, this is all we got, just do it, even though we're not really sure it's going to do anything. That was totally unacceptable to her. And she said, you can tell me this is going to get my child better for sure, or we're out. I don't like this kind of it might not do anything, but just will do something to you, which, as we know, antibiotic resistance is a really big issue. So she didn't want to just flood our microbiome with tons of antibiotics if it wasn't going to work.